I wanted to talk to you about was an important concept in breast reconstruction, and that is that the breast reconstruction result, you can expect a cosmetic result after breast reconstruction. That design, artistic design, the aesthetic shaping starts in the first step. One of the most important parts of getting a beautiful final result is planning for that beautiful result before the mastectomy even happens. Because once the cancer is out, I find that most patients feel like they are a cosmetic patient. They want a beautiful result. They want a natural looking result. And I think that's okay. I think that breast reconstruction should, in many cases, look as good as a cosmetic surgery result. The aesthetic result has to be designed from the beginning of care. I feel that many times a breast reconstruction surgeon that I know will say, well, they had breast cancer and so that's why the result looks like this, or those scars, those big scars are because they had breast cancer. But if you plan the mastectomy and plan the reconstruction from the beginning, you can hide the scars, or you can have scars that look identical to those that someone who had a cosmetic procedure might have. A beautiful result comes from designing the result at the very beginning. And it's okay for a breast cancer patient to want a result that looks as good as a cosmetic surgical result. I know many breast reconstruction surgeons all over the country. I come to all of the meetings, I'm a part of the panels, I'm at a leadership level, both locally and nationally in the world of breast cancer. The medical advisory committees for the Breast Cancer Resource Center and many aspects of breast reconstruction because it's near and dear to my heart. But when I come to meetings, listen to lectures, and I talk to other providers, I often find there's an attitude of, scarring is to be expected, shape problems, non-natural looking result. An expectation that's so low that the patient is going to look good in clothes. That's a reasonable expectation. That's the minimum expectation. To look good in clothes is a C- result. What is an A result? Well, let's talk about that, right? If we're grading a result in terms of reconstruction, and my expectation is that the reconstruction is going to look cosmetic, we want to think about the minimum criteria for good reconstruction is that the patient looks good in clothes. But what's the next level? The next level is looks good in a bathing suit or looks good in a tank top, right? I live in Texas. Patients wear tank tops 9 months out of the year. So it needs to look good in a tank top. But how does it look in lingerie? So that's the next level, okay? That's a solid B+. If it looks good in lingerie and the patient feels a little bit sexy, that's great. What does their spouse think, right? That's the lingerie test. Do they look natural in lingerie? But the best result you can do, the best result you can get for a patient, and what I strive for each patient, is that when she steps out of the shower, when she's alone, and she glances in the mirror in 5 years, is she going to look in the mirror and feel whole, healthy, and well? Because she's been treated. She's not sick anymore. But when you see lines or deformities or asymmetries and you look in the mirror, patients will tell me that they see illness. And it's not just about a cosmetic deformity, it reflects on illness. But they've had their treatment. Breast cancer in many cases is treatable. So I aspire to develop a result right from the early planning process. I want to develop a result such that the patient will have an A+. And an A+ result is that they look in the mirror when it's just them, it's not about anybody else. How do they feel and do they look healthy, whole, well, and symmetrical, even when they don't have anything on at all. And that's a daily result for them that tells them that they feel healthy. I love that. Yeah. I love when a patient feels confident and healthy.